One of the major tasks and potential dangers for residents feeling the wrath of the storm right now might be, well, shoveling all that snow off driveways and the sidewalks. And listen to this. Each year, there are about 11,500 visits to the emergency room for injuries related to shoveling snow. Let's go to New York and Dr. Devi Parampil, the NYU School of Medicine. Dr. Devi, what a pleasure to see you. You're outside there at the Rockefeller Center, right? How you holding up there?
Out here. It's not too bad. It's kind of fun, you know?
Yeah? Tell me, doctor, why are there so many snow shoveling related injuries every year?
Well, it's a huge problem. I mean, if you're out in the snow, there's already so much stress on the body just trying to keep itself warm. Now, there are two types of injuries. So first of all, the most common is musculoskeletal, where you injure your muscles or your joints. So that's because, you're not getting as much blood flow to these areas, and you're doing things that put a lot of strenuous exercise, a lot of taxing labor on those areas. So back injuries are the most common. Now, some of that might be because you're bending, you're lifting, you're twisting, you're doing these different activities that actually put a lot of stress on the discs that are in your spine. They're the cushions of your spine. Now, the other thing we worry about, they're not as common, but they're actually the most dangerous, is if you put a lot of stress on your heart, you're at risk for a heart attack, and those are actually more common when you're snow shoveling. So something to worry about.
It sounds like it sounds like common sense, but what are some simple ways to protect yourself?
Well, the easiest way is to actually take a break, I mean, I'm one of those people that likes to get a job done all at once, and a lot of people are, but in this case, that's not the best approach. You want to take frequent breaks, you want to pace yourself, and in general, you want to do some kind of warm-up before you go out into the cold and just suddenly start shoveling snow. I mean, the other thing is try to use whatever tools you can to help you, whether it's a snow blower, whether you hire someone else to help you as well, whether you use those ergonomically correct shovels and sprays and salts, you try to do as much as you can to make the job easier for you. And of course, wear the proper gear, keep yourself warm, have the proper gloves, the right footwear, because the other injury that's pretty common in this type of weather is a slip and a fall.
Yeah. And talk to me about some of the common symptoms of a heart attack. You were mentioning that just a few minutes ago.
Right. So one of the difficult things is sometimes the person might have chest pain or left arm pain. They might have some pain radiating into their jaw. Those are the most common symptoms. But, people might think that they pulled a muscle because arm injuries are common too. So you want to have a low threshold. Even if you think you pulled something, better to call 911 and get checked out. Now, other signs are also there. You could have shortness of breath. You could have nausea. Sometimes you might feel lightheaded. Exactly. So those are things to look out for as well. And if you're diabetic and you have any change in your blood sugars, anything that seems out of whack, better to be safe.
Dr. Devi Parampil, a pleasure to see you outdoors for us this morning. It's always great to see you.
Nice seeing you too.